Next slide, please. And this also has a very direct link with health, because it's not only about decarbonizing our energy system, but it's also about delivering energy in a much more sustainable way and in a way that can be accessed by local communities. To give you an idea, we have data that says that about 1 billion people globally, this data developed by the WHO, 1 billion people globally are still served by healthcare facilities that don't have reliable access to energy. You will have much better stories about this than I do, or much more meaningful stories about this than I do. But we have heard from healthcare workers in underserved settings saying how women have to deliver in the dark, how they don't have energy to develop life-saving medical interventions because they don't have reliable energy in their hospitals, in their local clinics, in their local care facilities. And about 800 million or 700 million people globally still don't have access to clean energy in their homes, still suffer from energy poverty. And why this is important and linked to climate change, because we could be providing low carbon renewable energy access by renewable energies that don't require a big grid infrastructure, don't require access to the central energy grid, to local communities, to off-grid communities, to remote places at very low price, if that is done right and with good technology transfer and with good financial support. But that is not happening, and not nearly at the pace needed. And what that means for health is that we see, as you see in the graph there that you have on the left, 2.4 billion people still use dirty fuels and inefficient technologies in their homes for cooking. And if you look at countries with different level of human development index, it's the poorest countries, those with the lowest level of human development index, that still meet 92% of the energy needs from biofuels, meaning that they're burning dung, they're burning waste, they're burning biomass and wood inside their homes to meet their energy needs. That leads to enormous levels of air pollution, people breathing toxic air. It also leads to generally, it is women and children that have to go and source the fuel, keeping them away from education, keeping them away from employment. And obviously, energy and good energy access is essential for health, is essential for development. So this is a sign of energy poverty that has huge health ramifications. And we could be providing clean, renewable energy to these communities.